How many times do you actually urinate in 24 hours? Is it 4? Is it 12? Or have you stopped counting because it feels like you live in the bathroom? Most men have absolutely no idea what the normal number is until they lose the ability to control it. Here's the reality. Your bladder is the dashboard of your health. It doesn't act randomly. Whether you are rushing to the toilet every hour or going all day without a single urge, your body is sending you a loud, clear signal. As a urologist, the most heartbreaking thing I hear isn't about the pain. It's the phrase, "Doctor, I wish I had paid attention to this sooner." Don't let that be you. In this video, I am going to give you the exact medical range for normal urination frequency, the specific red flag numbers you cannot ignore, and what your daily habits are secretly revealing about your prostate and kidney health. Before we talk about disease, let's answer the simple question that could save your health. What is your number and what is it trying to warn you about? Everyone wants the magic number, so let's start there. For a healthy man with normal kidney function, the medical textbook answer is usually between 5 and 7 times during waking hours. However, treating this as a rigid rule is a mistake. Context is king. If you are drinking a gallon of water a day or consuming 3 cups of coffee, hitting 8 or 9 times isn't a disease. It's just your kidneys doing their job efficiently. Conversely, if you work outdoors in the heat, urinating only 3 times might be perfectly normal for your hydration level. In my clinic, I often see men panic because they hit the high end of the range, yet their stream is strong and painless. That is simply physiology, not pathology. The real danger signal isn't the number itself, it is the deviation from your baseline. If you have consistently urinated 4 times a day for decades, and suddenly, without changing your diet, you are going 8 times, that is a massive red flag, or the opposite. You used to be regular, and now you can go 6 hours with a full bladder but feel no urge. Your body is screaming that the mechanism is failing. So the question isn't, is 7 times normal? The question is, has my normal shifted? Recognizing this shift is the difference between catching a problem early and causing permanent bladder damage. So when does frequent officially cross the line into dangerous? Let's look at the specific warning signs that tell you the system is breaking down. So where do we draw the line? In the world of urology, the specific clinical cutoff is 8 times during waking hours. If you are going more than 8 times while drinking a standard amount of fluid, that is classified as urinary frequency. But here's the critical distinction that most men miss. Volume matters more than the count. If you go 10 times a day but produce a strong, full stream each time, you might just be well hydrated. However, if you are rushing to the bathroom constantly only to squeeze out a tiny amount, less than a small cup of coffee, that is not normal physiology. That is a false alarm. Your bladder is acting like a broken sensor, screaming that the tank is full when it is barely at 20% capacity. This is the hallmark of an overactive bladder, OAB, or the early pressure of an enlarged prostate irritating the bladder wall. The real danger here is normalization. You tell yourself, I just have a small bladder, and you unknowingly adapt to it. But by giving in to these frequent, small urges, you are essentially training your bladder to shrink and hold even less over time. So if you find yourself standing at the toilet wondering, is that it? Why did I rush here for just a few drops? That is your body waving a red flag. And usually, this daytime frustration is just the prelude to the biggest disruptor of all. What happens when the lights go out? Now, we must flip the coin to the iron. Bladders, the men who pride themselves on going all day without a break. If you are urinating fewer than 3 times a day, let me be clear, this is not a superpower, it is a hazard. When you hold urine for hours, you aren't just ignoring a signal. You are turning your bladder into a stagnant pool of concentrated toxins. This highly acidic fluid creates the perfect breeding ground for kidney stones and chronic inflammation. But the terrifying long-term consequence is bladder atony, essentially stretching the spring until it breaks. By constantly ignoring the urge, you overstretch the bladder muscles and dull the nerves. In my clinic, I perform ultrasounds on men who claim they don't need to go, only to find their bladders are still holding massive amounts of urine. They have literally trained their bodies to stop feeling full. And once that sensation is gone, restoring the bladder's ability to contract is incredibly difficult. So I have to ask you, are you infrequent because you are healthy, or have you simply deafened yourself to your body's distress signals? Understanding your daytime number is vital, but it is only half the story. To get the full picture of your health, we have to look at the time when you shouldn't be going at cocinas, the nighttime. Now let's talk about the time that matters most, the night. Here's the clinical gold standard. If you are under 60, the target number is 0. You should be sleeping, not navigating the dark to the bathroom. Once you cross 60, waking up once is acceptable. But the moment you hit 2 or more times, that is the medical definition of nocturia, and it is a game changer. Statistically, this is the loudest alarm bell for benign prostatic hyperplasia, BPH, affecting over 70% of men with urinary issues. But the danger goes deeper than the prostate. Nighttime waking signals that your brain might be failing to produce enough ADH, antidiuretic hormone, to slow down kidney function during sleep. And the cost of this disruption is brutal. We aren't just talking about morning fatigue, we are talking about a direct hit to your testosterone production and sexual health, which happens primarily during deep sleep. Many men shrug this off, thinking it's just an inevitable part of aging. I am here to tell you, it is not. It is often the earliest, clearest sign that your internal system is falling out of balance, so knowing your numbers is the first step. But what do you do if your count is too high? In the final section, I'll summarize exactly when you need to see a doctor and the simple lifestyle tweaks that can bring your numbers back to the healthy range. Ultimately, let's stop obsessing over the math and focus on the mechanic. In clinical practice, the specific number matters less than the quality of your life. A healthy urinary system is defined by freedom, a strong, uninterrupted arc, a sensation of complete relief, and most importantly, the ability to leave your house without mentally mapping out every public restroom along the way. If you notice your stream is losing its force, if you have to strain to start, or if you zip up feeling like there is still something left, do not ignore it. These are not just annoyances. They are the early whispers of obstruction or nerve damage appearing long before a total blockage occurs. Listen to these whispers now so you don't have to deal with the scream later. If this video helped you find your normal, please hit the subscribe button and leave a comment below. I read them personally. And don't go anywhere because in the next video, I'm going to reveal the top 5 foods that can help strengthen your stream and calm an overactive bladder naturally. You won't want to miss that. I'm Dr. Emily Carter, and I'll see you in the next one. I want to leave you with one final thought, because this is the trap that catches the strongest men. Stoicism. You tell yourself you can endure just a little more, holding it longer, waking up one more time, accepting the struggle. But here's the hard truth no one tells you. Your urinary system doesn't collapse overnight with a loud bang. It erodes silently like water wearing down a stone until one day you realize you have lost control completely. So forget the national averages. Do not compare yourself to your neighbor. Your only benchmark is you, the man you were 5 years ago. If your habits have shifted, if the sensation has dulled, that is not random chance. That is your body begging for attention before simple maintenance becomes complex surgery. Listen to it, and if you are sitting there thinking, Dr. Emily, it's probably not that serious yet, then you cannot afford to skip this next video. I am going to expose the shocking physical mistakes men make while urinating, habits like power voiding and poor posture that seem harmless, but are quietly destroying your bladder and prostate every single day. You might be damaging yourself every time you step up to the toilet. Click right here, keep watching, because you are about to see yourself in every single point